Chris, today we're talking about birth injury medical malpractice. And, birth injuries can be obviously devastating for newborns and their families. What are some of the most common types of birth injuries that could be caused by medical malpractice?
Well, yeah, you're exactly right. They are the most devastating kinds of injuries because most often they happen on what should be the happiest day of a parent's life. They're going in thinking they're having a brand new baby, bringing a new life into the world, and something tragic happens, which changes their course of their life and their child's life forever. Um, the two most common types, and by far the most common type is when when a mom goes into labor, it puts stress on both the mom and the baby. And as the labor progresses and contractions get stronger, it can affect the amount of blood flow that passes. The baby gets all its blood, from mom, and blood brings oxygen. So it gets all blood and oxygen from mom, through the placenta, that goes, through the umbilical cord. As contractions get stronger, it can, cause disruption in the blood flow. So fortunately, medical science has a thing called a fetal heart rate monitor. So when the baby's not getting enough oxygen, the baby's heart rate, the first thing it does is slow down. So normally a baby's heart rate should be between 120 and 160 beats per minute. The fetal heart rate monitor will tell the doctor what the baby's baseline heart rate is. So let's say it's 125 beats a minute. Well, if the baby starts not getting enough oxygen, not getting enough blood flow, not getting enough oxygen, if that goes on long enough, the heart rate will drop. And the fetal heart rate monitor will tell the doctor that. Now, what will normally happen is it'll happen in relation to the contraction. So, if there's a contraction and the baby's heart rate drops after the contraction, that tells the doctor that the baby needs to be delivered pretty quickly because, the baby's having stress and the baby could be in trouble. And if the doctor doesn't do that, doesn't get the baby delivered and lets that go on, and with every contraction the mom's having, there's a depriving to the baby of oxygen. Over time, that's going to cause, brain injury to the baby because the baby's brain needs, blood and oxygen to survive.
So is that the most common type of birth injury then? Yeah, so you get brain injuries because of lack of oxygen.
Most common is when the baby is being delivered in a natural. Most often, although it can happen a C-section, but most often during a natural delivery, the baby's too big for the birth canal. Baby gets stuck. The doctor starts pulling on the baby. It can cause it's called a brachial plexus injury, which the brachial plexus are the nerves in the neck. They can pull and stretch those, which could cause the baby's arm to be paralyzed. So that's a brachial plexus injury. So those are the two most common types of injuries that occur during birth. And then third would be if there's an attempt with to deliver the baby with forceps or with a vacuum extraction. Those can also, that type of delivery of too much force is used, trying to get the baby out during those, what are called mechanical or assisted deliveries. Those can cause injuries to the baby's head and brain as well.
So during pregnancy and childbirth, there's a lot of decisions that everybody has to make, including doctors and nurses. Can you explain how a doctor's failure to follow established protocols might constitute medical malpractice in a birth injury case?
Well, sure. I mean, most of the guidelines and protocols are set up to protect patient safety. So anytime a doctor doesn't follow the protocol, unless they have a darn good reason for not doing that, that's generally negligence. But in terms of the protocols, most of the birth injury cases occur during labor, not during the prenatal period. I mean, during the prenatal period, the the most common errors are not monitoring the size of the baby, which can be determined either by measuring the mom's the growth of her abdomen over the term of the pregnancy, or ultrasound is the most accurate way. Not every mom wants to have ultrasounds, but it's the most accurate way to estimate the baby's weight. And so, if the doctor's not following those protocols and the baby gets too big for to be delivered through the mom's pelvis, and they try that anyway, that would be negligence. But most of the time, it's failing to monitor during labor, failing to recognize signs of fetal distress during labor, and failing to deliver quickly when the baby's in trouble. And the last thing would be not to have other doctors there to help resuscitate the baby once the baby's born. When there are signs of the baby being in distress.
Is it a challenge to distinguish between what might just be an unfortunate outcome, because birth is obviously just a difficult thing, and used to be much more difficult than it is these days with all of the medical science that we have now, but it's still a dangerous thing for both the mom and a baby. Is it hard to distinguish between just an unfortunate outcome just because of normal circumstances versus a situation where legal action might be warranted?
Well, I don't know how to answer that question. I mean, honestly, no, it's not that hard to distinguish. But on the other hand, they'll make they'll make it hard to prove in court. Obstetrics is one particular branch of medicine that is very defensive. Medical articles are written to try to justify things that are commonly done by obstetricians that are actually negligence, to make it seem like, it's standard of care. But generally, I mean, if you've had a normal pregnancy, everything's been fine through the pregnancy, you should have a normal delivery and a normal baby. I mean, there are some rare circumstances where, something happens, like the baby could have a stroke shortly before delivery, whatever. But that's going to be obvious from if an MRI of the brain is done. Usually, if there's some kind of brain injury, an MRI is done within days of the birth, which will have a pretty good roadmap as to what happened and when it happened. But to the normal layperson, I would think if there's anything, if things don't go, if everything was normal in your prenatal period, your pregnancy, and some, and your baby's not, having problems. I'm sorry, if the baby is having problems, or delayed in their development, it would definitely be something to look into.
Evidence is obviously crucial in any kind of legal case. What kind of medical records or documentation are important to gather when you're considering a birth injury malpractice lawsuit?
Well, sure. The fetal heart rate monitor that I mentioned, that prints out a strip second by second record of the labor and the baby's reaction to labor. That's usually the most important thing. In a case involving a brain injury during labor and delivery from lack of oxygen or hypoxia. But always, it's always the medical records that are important in a case like this.
And so having an attorney, I would imagine, would be important in that case, because your likelihood of you being able to ask the hospital for your medical records and get something like the fetal heart rate monitor information is probably slim, but a lawyer would have a better shot at collecting all of that information, right?
Yeah, absolutely. And definitely a lawyer that handles birth injury cases. It's malpractice cases in and of themselves are difficult enough, but birth injury cases are even a special step above as far as the terms of complexity and medical knowledge that a lawyer needs to handle those kind of cases.